All right, well, welcome everybody. We're going to go ahead and get started, and definitely excited to be talking with John Kukoly this morning about the top 10 nonconformities in the BRCGS issue 8 standard. So the standard has been out and live and being audited against for how long now, John?
For 6 months, so we've got a good chunk of data to look at.
Yeah, so this will be good for those sites that maybe haven't been audited yet under issue 8 to get an idea of what they need to focus on to really make sure that they don't, get hit for the same issues that are coming up for other companies. Maybe for those that have already been audited, hopefully this will be some useful information as well for next year's audit to help with, maybe closing if they're having some of the same issues. But always good to kind of talk about opportunities for improvement in food safety. So we've got Antonio Munguia here. I don't know if you want to introduce yourself.
Hi, Antonio Munguia with Safe Food Certifications. And well, since the issue 8 came out to be audited, I've been out and about doing so. So I'll have some experiences also, to share with you of what I've seen.
Great. And I'm John Kimball, the Senior Food Safety Manager for Safe Food Alliance. So I'm involved in a lot of our training activities, the web-based training that we do. I do some audits as well. And of course, the star of the show, John Kukoly. Go ahead. You can go ahead and introduce yourself.
Yeah, good to be with you guys again and with the audience. John Kukoly, Director for BRCGS in the Americas. So I've been with BRC about going on 11 years now. So I've got a good long history with them.
Yeah, yes, definitely. So we've been working with John for a good number of years now. And so looking forward to getting into the meat of the presentation here. And so we'll go ahead and jump in. So all of you attendees, you'll be muted during the webinar. So we do encourage you to submit your questions via chat. So you've got a little chat function there in the webinar platform. And that's how we take our questions. And we try to answer them live as quickly as we can. We don't wait till the end. So please jump in and ask if you've got something that you'd like clarified. And then do follow up with us after the webinar for help. Stay in touch with us. We do encourage questions and we try to help as much as we can. So John, with that, I'll go ahead and jump into your content. You can go ahead and run with it.
Okay, very good, and looking forward to both of you, especially throwing in some real life experience from the auditor and certification body perspective. So thanks everybody for being a part of this. We'll go on to the next slide. We'll get rid of the, and as you had mentioned, I think earlier already, all of these slides will be available to folks. There's a couple of good ones. I know people would like to have a copy of it afterwards, so absolutely this is available to everyone else. Now, where does, when we roll out a new standard, shortly after rollout, we throw out the interpretation guide, frequently asked questions. That usually gets pulled together primarily from the training and some of the guides for the changes. Those are available to everyone that's certified through Participate. They're available in the bookshop as well. Some of them are, most of them are free downloads. They're all freely accessible on Participate. So any certified site, anybody that's going through BRC that needs access to that, just get in touch with the good folks at Safe Food Alliance or with us, and we'll make sure you get access to those. They're pretty good documents. The other piece as well, once you're certified, of course, we will keep you up to date with any, occasionally we have to issue position statements. Antonio and John, I know you've seen some of these already. If we have to make either a clarification or a slight adjustment in what's in the standard, position papers will come out on occasion. So we'll jump right into it.
Yeah, and John, I will say the BRC Participate, the implementation guidelines were my go-to when we were certified to help understand what the clauses require and what they mean by what they say.
Good. Yeah, that could be a very useful document. So I'm gonna give you two little graphs, two peeks into things. And what I've done, on the left is the graph and on the right is just the explanation of the data you're looking at. So this represents all food aid audits completed in the United States. We started food aid audits in February, so we're talking just over 1,200 audits. And it was done, those 1,200 audits were done by 173 different auditors, average of 5.3 non-conformances per audit. Now, that is just one little piece of the data that comes from our Insight platform. So you all know that we had the BRC directory. That's where the audit reports were uploaded. All the details were uploaded. You could go on, there's a public side of it, and verify that your suppliers or yourself contact information is right. We've put a new outward facing face on it. We call it Insight. And what it does is it allows us to take a broader look at all of the data that those audit reports represent. And in particular, the query I ran here was, show me the non-conformances that happen in the US. Important to know, that's what we want to see. And if you go to the next slide, what I did further, because I know that primarily you have a lot of fruit, vegetable, nut producers as part of your group, I did a deeper selection and said, okay, same date run, so food 8, everything since February, but let's only look at category 5, and that's what I wanted to focus on. So these are the most common non-conformances for category 5, so the fruit and veg area, in the US. 50 audits, not a huge data pool, but still good sample because it's focused. 29 different auditors, slightly more non-conformances per audit. And if you look at the graph, on the left-hand side, it lists the clause number. On the right-hand side, the blue bar tells you what percent of the audits it was found in. And the red dot is exactly how many were found in, and just because of the small sample size, they happen to line up. So we've got some good data to work with. That's what John and Antonio asked me to start with. So there we go, guys.
Yeah, that's great. That's great. And so those are, that's, a longer list than 10 there in that graph that people can take a look at and make sure they understand what the auditor and what the standard are looking for in those clauses. So that's good information.
Yeah, and it's a nice system. I mean, we could have broken it down further and looked at individual certification bodies, individual auditors, and that's how we do a lot of our compliance work behind the scenes to make sure, everything is operating in as good a calibration as possible. But I wanted to focus on this, so we'll go to the next one. And
Definitely.
what I've done now is chosen the top, I believe, top 10. So these are the non-conformances that ranked most common, and if I remember correctly, 7 of these also are in the top 10 for all categories throughout the US, and 6 of them, I believe, are typically global. So although there's a little bit of uniqueness because I broke it down to category 5, looked only at the United States, it's not. There are some anomalies in that, but not necessarily significantly different if you're not in those categories. So the first nonconformance was against 1.1.2, and this is where the standard asks for you have a food safety culture understanding. And the way we put it in place for the standard was you have 3 steps. You understand it, you understand what food safety culture is, you have a mechanism to measure the culture or assess the culture, and then you have an ongoing continual improvement program to take those measurements, put actions in place for improvement, and continue on with that plan, do, check, act cycle. The non-conformance most common is, and it tends to be a fairly high ranking one, people haven't done anything. They don't know where to start. They don't know where to go. I don't know what you guys have found in that area.
Yeah, that makes a lot of sense because this is still kind of a newer concept in the food industry, right? So
yeah, and going around, in the certifications, yeah, I think this is one of the non-conformities that I would say it's been in the 90% of our audits. And again, part of it is like the sites still do not have a good understanding of what's expected. And sometimes they get confused saying, how am I gonna measure something that's so subjective, and and they just have trouble grasping what BRC really wants and what the intent behind this is. So I think, part of what a site should do is like really think about the intent and the elements that the auditor is going to be looking for. And I think, as you will explain later, we're not looking for, as an auditor, to measure things or to see how good of a system they got is where at this point, what we've been guided to do is, okay, look for the elements, look that they did an assessment, look at, they found the opportunities, uh, the plan to address those opportunities, the timeline and the strategies to implement them, and then the system to measure them. So that's what I'm looking for as an auditor, and it seems like there is a, a big lack of understanding, from companies as to what is expected, and I think sometimes they're overthinking it and just getting themselves into a not exit kind of a situation.
Yeah, I would agree. And the other thing too, I think, and we've seen this in other aspects of the standard, when you think of it, although it is food safety culture, we're talking about culture is really not the necessary skill set for your average technologist, the average person who's the manager, director, or supervisor within the quality or food safety department. This is one of those times, just like the senior management portions. It's not QA that does it, it's senior management. Just like maintenance, it's not QA that does it, it's maintenance. This is almost an HR function, and this is where we expect to see, at the very least, or typically, senior management has directed HR to take this one on and deliver a assessment for the culture of the organization. It's very much a people-oriented one. So, yeah, you're right. It's people sometimes just don't know where to start, and sometimes it's not the right people that are trying to take this one on. If you move to the next slide, and this is not a requirement. It's a solution we have. We actually had this in place before we put the requirement in the standard. We have a very inexpensive mechanism to measure culture. I don't know if you guys have used this one in any of the sites or seen any of the sites that use it. It's becoming more and more popular. McDonald's has now picked it up, and globally they're using it both in restaurants and in suppliers to assess their culture. They see it as an excellent little tool. It's a nice snapshot. It's a good little piece.
The thing with food safety culture, we talk a lot about that now in the industry, and it's really, even not having this section in the standard years ago, it was still baked into the intent of the standard, right? It's something, you don't, take somebody who is in the food safety world and say, okay, you're responsible to make sure there's a food safety culture here at the company. The rest of us, we're going to go about our business, and we're going to do what we do, and we're going to make food products, right? It's really the intent of this section really is to say, look, it's everybody's job, right? Food safety is everybody's job, and that needs to be part of our culture. So I feel like even though it wasn't specifically called out in a section per se, it was always the intent of the standard to have a culture of food safety. Mm-hmm. Don't you think? Yeah.
Yeah.
So
I would agree.
Yep, absolutely. By and large, if you don't have the good culture, you're not gonna have an effective food safety program. So after that big one, this was an oddball one. The second most common non-conformance, and yeah, I just got a stock photo from the internet on this one. It's protective clothing, believe it or not.
Wow.
Provided in sufficient numbers, suitable design, fully contains hair, includes facial hair coverings. And this was one of those unique ones that really only manifested itself in category 5. We didn't see it as big. And I think what we have primarily in category 5 is that we have a lot of smaller, newer facilities that are coming on. We see that quite a bit. BRCGS's certification is an area that, and probably due to the good work that you folks are doing at Safe Food Alliance, but it's just that sometimes, and when I looked into the non-conformances, we saw there are some activities where people are not having sufficient, they really didn't do a good assessment of what potential could happen. A lot of times it happens around home laundry. And a lot of times people are just assessing the uniform or the protective clothing from a perspective of food safety, and sometimes forget food quality. And, when it comes to food safety, I would tend to agree that uniforms don't really play a major role. From a food quality standpoint, they absolutely play a major role, especially when you have employees who potentially are doing home laundry. What are the rules around transporting it? What can you wash it with? How do you wash it? Making sure procedures are in place so that home laundry is being done efficiently, having measures in place, and then having that real assessment on, okay, are we effectively protecting the product to the best way we can using protective clothing? I know this one came as a bit of a surprise to
Yeah,
you
it's kind
guys,
of
because I don't
surprising
think
to
you've
see this
seen
one.
it as
Yeah.
many. Yeah.
Yeah.
And I'm kind of wondering if this is more around, the not wearing adequate protection, or whether they're wearing something but it's not being implemented properly, or it's dirty.
Yeah, or sometimes, what happens in these types of operations too is like they think about protective clothing, about like PPE protecting the employee, but the intent in the standard is to protect the food from from
Yeah.
using this protective clothing. So sometimes the design is not good. They have pockets on top, and you see employees carrying pens, screwdrivers, and whatnot, and just part of the design also, and the way the employees are using them too. Sometimes they use a cap, and then they have the hairnet above the cap, and it is not capturing the whole hair. So a few things going on that regard.
Yeah. And I know it's not included in this one, but I know in the past year or so, we've seen a lot of discussion with new sites, especially in North America, about footwear, captive footwear. And I think this just talks to the fact that there are a lot of smaller and newer organizations, food manufacturing facilities, that are now moving into certification. And quite often when a facility is very small and they're just starting out, they don't have a footwear program. And then as they move to a size where they start looking at certification, that could be a big investment for a company to say, you know what, we always allowed people to wear street shoes on into the plant. They just put on a uniform or a lab coat. And now we're actually asking them to keep footwear here. We need lockers, we need change rooms, we need all these things. And that's where stepping up into the more rigorous food safety expectations is a big piece for some companies.
Yeah, and that's an interesting one that you mentioned, captive footwear, because I have heard, and I haven't really looked at a lot of the data, but I've heard there have been a lot of studies done on different, because there are a lot of technologies, right, for control of pathogens from feet.
Yep.
And it seems that captive footwear is really the best approach, because you've got the granules that get all over the place and they don't really do much. You've got the sticky mats, you've got the foot baths that you have to stay on top of, and then they spread moisture. So yeah, definitely something that could be a focus area for a lot of companies, for sure.
Yeah.
For sure.
Absolutely. Okay. 4911 was, I think, the third biggest one. This is really about non-food chemicals. And, this goes back to much more of a traditional issue in audits. We're seeing it crop up against, and what we see is usually either it wasn't stored properly within the facility, or they had something that just wasn't on the approved list. And when we look at recommendations, those tick marks at the bottom, how you combat this, and you have to combat it carefully. A lot of companies, what they'll do is they'll send somebody around 2 days before the audit, check every cupboard, gather up all the stuff that shouldn't be there, and hide it. That mechanism doesn't work for a couple of different reasons. One, your chances are, if they opened a cupboard and found an unapproved chemical in there, there's a reason it's there. It's a tool for people to get their job done, or to clean up, or to do something. Quite often, it's a needed tool. When you take it away, it's going to reappear. It wasn't there and no one was using it. That doesn't happen. It has to be challenged, and when you do find something like that through your internal audit program, and that has to be ongoing, not just before the audit, you identify something that's in an unexpected area or uncontrolled or wasn't approved for purchase, you have to back up, ask the question, what is this getting used for? Why do we have it here? What's our appropriate alternative? How do we do this safely? And then move on. Simply grabbing that can of WD-40 and tossing it out this week, it's going to be right back next week, which is not an effective way to move forward. So this is fortunately a nice, easy one to solve, but
Yeah.
Don't just do that knee-jerk cleanup before the audit.
No, and what I've seen a little bit more of this problem is when we have like operations that are integrated. Let's say they have the packing process inside but then, in the same property, they have equipment that works for the farms and everything. So they use different chemicals, they store pesticides, they store, some mechanical chemicals and things like that. So, at the end, there is no physical barrier. The employees are free to go back and forth.
Yeah.
Even though it's the same ownership, it's not the same, legal entity. And what we're certifying is a part of the property that can be affected by this other operation that's in there.
Mm-hmm.
So companies like that in that situation need to understand that they need some control. Like, we don't care, like, it is your family. We don't care that, we all, our employees are aware and this and that. Well, we're protecting a site and we're certifying a site. That site should be, very well delineated and have controls that don't necessarily have to be physical controls, but, something that does the job.
Yeah, that's kind of a common gap, right? Is that things aren't adequately separated. And so you've got access to things from another area, whether it's maintenance or whether it's the farming, operation on site that's in a different building, or whatever the case, right? Or even, something up in the front office that's a chemical that's left out for, cleaning the computer off or something. But another thing for me, I think it's about convenience too, right? So we control all of our chemicals by putting them in a locking cabinet in the back of the warehouse that's a 10-minute walk away. And so anytime I need a chemical, I don't have access to it. So then you wonder why there's a canister of some chemical on the production line. Put a cabinet there on the line, right? Make it, if you need it,
Yep.
if you need it nearby, put it nearby, right? It's kind of a lean manufacturing approach too, is, where do we need things to be at in order for them to be efficient and effective? So we do have a question. I think it's an easy one. Captive footwear is still a recommendation, but not a requirement within BRC. And yes, that is true, right, John Antonio? It's not required. It depends
It is required, like, for high risk and high care operation. Yeah. Not for.
You saw me reaching for my copy of the standard while you were reading that question out. Yeah, I just absolutely, you got to bring it
so
right
it's
on
not
it.
required for everybody. It's
For low risk,
based on risk.
it's not.
Based on risk.
For high risk, high care,
Yeah.
it is a requirement.
Our secret weapon when we get food safety questions, right, Antonio, is it depends.
Right.
Right. That's what everybody in the
It
food
depends.
industry, that talks about food safety. They use
It
that
depends
phrase
on
a lot.
risk, of course.
That's the secret weapon. So, but again, yes, definitely submit your questions if you've got them. And I do want to mention too, we've got a poll, and we wanted to wait a little bit to put it out and not do it right at the beginning, so we capture a few more people on it. So we're going to launch the poll questions, and as we talk, please feel free to go in and answer them and let us know where you're at on your journey to BRC. We definitely want to see kind of what level of certification you've got, or who's participating in the webinar, so we can kind of better answer your questions and speak to your place within the operations. So
there we go.
all right, so on to the next one as they take the poll. John, if you want to go ahead.
Absolutely. Now this is back in section 1, so in the management section. It's 116. It's the other brand new clause about a confidential reporting system. And again, what we tend to see is they don't have one, or they simply don't have a consistent, they have some way of employees informing management, but they don't have a consistent approach to dealing with it on how do we look at it, who's responsible, how do we respond, how do we make it fairly simple. There are a bunch of different options for doing this. I mean, it could be everything from the expensive 1-800 number. Quite often you have employee helplines, things like that, where people can talk about this, all the way down to something as simple as a suggestion box without a camera. Remember, go back to the concept. This is tied to culture. The culture should be that we are all in this facility to protect our consumers and to protect our product. And I feel I can I can identify to senior management without any fear of repercussion if I feel we're not doing our best at those things. So when we say the fear of repercussion, that's hard to measure unless it's anonymous. So some mechanism for anybody in the facility to report through to senior management at some way to say, I have a concern. I don't think we're doing our best to protect our customers, our consumers, or our products, and this is what we need to do. So it's a fairly simple, easy one, as long as you don't overcomplicate it.
Yeah, I do agree with that, and I've also, encountered this non-conformity in my audits, and and something that I think, especially family-owned sites or like smaller sites, they say, well, we are all family, we can, we have the trust, and our employees trust us and everything. So we thought that that was not applicable to us. I said, well, it is applicable to you, because even though they feel, all that trust and everything, it is still a requirement. It is on a fundamental section of the standard, and you'll have to do it. And sometimes also I've encountered, like in these kind of places where they also say that don't take into consideration conflict of interest. Who is going to review those, those suggestions or complaints from employees? What if it is just the QA manager, but it is something that affects the QA manager? Or what if I'm, part of the family, and then I don't want my dad to find out, and that I'm doing something that an employee reported, or I don't know, the wife or the husband is in an upper position.
Yeah.
So that's something that I've given a non-conformity for not thinking also about conflict of interest when reviewing these things.
So as you say, it's just the QA manager looking at the suggestion box, for instance, right? And the concern is over the QA manager, so there's a conflict there, right?
There is a conflict, or like if there is like the plan manager reviewing, what about if it is the plan manager or the production manager? So my thinking, and just out of what I've seen, is like a committee, would be a good approach, for reviewing those complaints.
Yeah, definitely. And technology does give us a lot more options with this, right? But even the good old suggestion box can work as long as it's used well, right? I mean, the suggestion box that's put on the wall, and then you put a lock on it, throw away the key, and you put tape over the hole so you can't drop anything in it, right? I mean, I'm being facetious, but if you're going to do that, you've got to monitor it and listen to the employees and implement suggestions, or at least consider them, right? Or it's not going to be effective. If people don't feel like they're being listened to, then it won't work, right?
It won't work.
So, so we've got some responses to our poll question. So we've got a good number of people that haven't started with BRC yet, which is interesting. We got some people that are considering switching standards, and a few that are working on certification, a few that have the start already in place, the BRC start, which I believe you've got a slide later, right, John, that touches on that briefly.
Very, very briefly. Yeah, absolutely.
But the largest number of respondents are already certified or haven't started yet. So it's a good broad section of the industry that we've got today. So that's great.
Excellent. Yeah.
So now we do have a question. So I'm going to go ahead and take a look at that. So bear with me as I lean forward a little bit. My eyes are getting older. So our facility implemented an anonymous reporting system, and the staff is using it. However, staff has used it as a mechanism to report HR or personnel related concerns. And I've heard this one before, not related to food safety, quality, or legality. Are we going to expect to present these HR issues during our audit? Good question. Really good question on that one. So as an auditor, then, would you say you need to show me all of the information, even if it's HR related and maybe confidential?
I think this is part of establishing a system and training the employees. A gap that I have also seen is that employees are not aware of that box is only for this type of issues and not HR issues. So only there is a lack of training to the employees and awareness. So I wouldn't expect to see this and I wouldn't ask for this. This is totally out of the purview of the audit. So just, one of the things is like we talk to employees, right? So if they know what they're using, what that should be used for, and that they don't have any feedback, any complaints on that box, well, so be it. But it has to be reported. It has to be a record, that we're reviewing, we're checking that box, we are, going about it. And that, I think that's the part it's missing, really having a system, like how it's gonna work, how we're gonna train employees, how often are we gonna check the box, who is the person or persons who are gonna check the box, where we're gonna review those things, how often is it gonna be presented to senior management, and when, hopefully, I mean that's kind of the intent that senior management is aware. So I think it's just a lack of understanding of the intent of these requirements. It's not just do something just to do something, right? It has a purpose.
Yeah, so making sure the employees understand the purpose of it is a good next step, right? But
yes,
I would also say, if people are submitting their HR concerns in the box, that's great. They're using the box. That's a first step, right? And just maybe redirecting, hey, don't stop submitting these HR concerns, but who do I submit them to? Where should they appropriately go? Because we want those addressed as well, right? And we get into some other legal areas that are maybe outside the scope of the BRC audit, but really the right thing to do is still make sure that those things are addressed and that employees feel comfortable still submitting those, right? I mean, those are important things because again, even if you're not going to ask that question or look at those during the audit, isn't that part of the company culture? And if employees feel that they're being listened to and that they are a priority to management, that goes a long way, doesn't it? Right? And the opposite is true. If they don't feel that management cares about what they say, it's going to hurt the culture.
Yep, maybe.
So I don't know, John, you want to jump into this next slide?
Absolutely, absolutely. Again, this is a nice, simple one. Easy to ensure you've got it right. 3.11.4. The requirement is if you have it used to simply say recall. It's been expanded now over the years to a significant food safety incident. There's some examples there. You have to inform the certification body in 3 days. Why do we do this? We need to step back. This is about, remember, the certification is it involves an assessment and verification that you have systems in place and evidence that those systems are working, that you are managing food safety and quality to the best of your ability. A significant food safety event is a flag. It could be an anomaly. I mean, we realize we're working with natural products, things happen. It could be something that was truly unavoidable, unmitigatable, or it could be evidence that the system is not designed as well as it could be, or not operating as well as it could be. And that's what we want. It's that third one that we want to swing into action. So if there's something significant, a significant food safety incident at the facility, it could be a flag to say, hey, wait a minute, maybe our risk assessment, maybe our plan, maybe something may not be right. The expectation is we let the site lets the certification body know. The certification body looks at the evidence, looks at what happened, what's the reasoning. Majority of times, I think you guys would agree, they accept the findings of the site, say, good job, carry on. On occasion, you have to go and take a look to see, get more details, more data, make sure that things were in place. On rare occasion, does it actually indicate that a systemic failure of their programs? I know we see those on rare occasion, doesn't come that often. But what it comes down to is make sure both senior management and your quality system identifies this. Have it a plain rule. Whenever we have an event, this is the process we follow.
I got to kind of wonder on this one if it's a lack of a procedure, John, or if they had an issue and they didn't notify the certification body.
That tends to be it. And most often what we've seen is they had that internal debate about, is this considered a significant food safety event? Do we need to tell our certification body about this? Whenever a facility's in that situation and they're having a debate, what do you guys recommend they do?
Yeah, I gotta wonder how they're making that decision. It kind of begs the question of, okay, what is our threshold, right? And what sort of issues would trigger this, right? And I imagine there's there's some good, thoughts on that within the BRC guidance and BRC participate. But it seems like it may be down to the operation, the company itself to also define that a little bit more.
Absolutely, they define it. The easiest solution though for a site, call you guys. Have
Call
the
us and find
chat.
out.
That's exactly it. You're far better off to call and you end up saying, yeah, actually, you know what, that's fine. That's not what we consider, but thanks for the heads up. We're all good. You're covered. Make a note of that in your incident log. This happened. We called them. We had a chat. It's so easy to take that extra step to cover yourself off than make a decision and then it comes back to end up as a non-conformance.
Yeah. Do you have anything to add?
Nope.
Okay.
I think it's clear enough.
So we got a question from the audience. From a chemical control standpoint, having an unlocked first aid cabinet in the production area. I lost the question. So would that be a concern, I guess, around having things like ointments and things, and what would be okay and what would not be okay, and should it be locked? I think is kind of the question, was something to that effect. So I don't know, Antonio, you want to take a dive at that one?
Well, I think again, it goes back to the risk, right? What kind of a controls they have in place? Obviously people need to have first aid access right away.
Mm-hmm.
So if the risk has been mitigated, if there is, some supervisor or management involved and see, how those substances are being used and all that, I don't see any problem with that. But if it is just there without any further control, then I would have probably more questions at the end. We don't make a decision just based on what we see, but we ask, right? And we interview and we talk, and if there are proper controls and the risk is being mitigated, like I don't see any problem with that.
So a risk to the operation might be a cabinet out in the production area with pills or some kind of chemicals that, or maybe a danger where they could get out into the food products, right? So, but if you have a system or a process for tracking when it's used and making sure that there aren't things like pills in there.
I mean, they might be there. I mean, if people need them, I don't know what kind of, things can be there. But again, everything comes down to control,
How
right?
do you control it?
And mitigating that from ending up in the product, either unintentionally or intentionally.
Because what you don't want is people running around hurting themselves and using it, and you don't know that they've used it.
Yeah.
You don't want things floating around in the production area. So some method of control, whether there's a tracking system and the supervisor has access, and that they're the ones that dispense it, or how that's done. At the end of the day, there's no single way to do it, right? It comes down to effectiveness, doesn't
exactly. I think that's the right word.
Yeah, and that's another one of those dual party decisions the facility should be looking at. They should have HR involved. Make sure you don't do something that's not legal. Make sure you're meeting regulatory around occupational health and safety, but also then food safety department's job is to make sure we are following the law. We're maintaining the safety of the products as well.
I will say here in California too, you really won't see pills in those anymore because there are laws. And of course, California, we love regulations, and so you won't see pills in those first aid boxes anymore. So how about this next one, John?
It's okay. Section 3.321, employee document control. And I know, you can look at all the requirements in there, but what we tend to see most common as a non-conformance is not doing good version control. So really that during an audit, we'll see somebody filling out a form. We'll look at the procedure back in the office about that activity, find out there's a certain version of the form, and they just don't match up. So this, again, fairly easy. And this ties completely into culture by empowering the individuals, because again, the hard thing and the least effective thing, somebody from QA wanders around, looks at all the versions of the documents that are in use, make sure they match. It's a one-off, it doesn't work. It should be, this is how we operate every day from everyone. So everyone should understand how version control works, the importance of maintaining version control and documentation control, and what their role is in it. Everyone, every day, whether it's I'm reviewing this checklist or I'm filling out the checklist, should understand their role within internal audit, within document control. So effectively, every time somebody picks up a document, whether they're filling it out, creating it, or reviewing it, they should have the mindset that I'm doing a bit of an internal audit on document control here. So I'm just going to make sure, yeah, it's version 6, it's good. People should be doing that. By all means, during that training, talk about, accept the fact that quite often people will have stashes of documentation. It's how the business operates. We accept it. Let's be open about it. Absolutely. It's, you guys do it. When we do version control, this is why it's so important. Make sure you do a control, you change over your stash of documents too. Let's not do that. Make your,
John? Oh,
yeah.
Sorry. I was just going to say, I bet if you went back to some of the earliest editions of BRC and pulled up the most common nonconformities, this would be up there still.
It's an ongoing one.
Right? I mean, we got so many documents, so many employees that it's a common struggle. What were you going to say? I'm sorry.
Oh, that's okay. And the other, well, and I was going on to the simplify your document control system. And to your point, we have what often happens is, an incident happens and something happens. We create a document now to as our corrective action. And 10 years later, that it's not even relevant anymore. So that what part of document control is also to ask the question, are we doing the right thing? Do we need this? Are we creating a record of documents simply because it was useful 20 years ago, but it no longer is? So we need to continually challenge and clean up, which helps simplify.
Yeah. Yeah. And we got to keep things moving along for the sake of time here. We're getting close to the end. But, I just want to add on this one, I think root cause analysis is a very important tool for document control, because there are a lot of different reasons why documents can go out of control, right? And whether it's not available to me readily, so I keep this thing stashed in my pocket, or when we update a document, we don't have a good system for replacing the hard copies, that we know about.
And I think, to add to that, also, I rarely see in training that document control is taught to employees on the floor. The ones that are using forms and procedures, so they don't know that, why we're controlling things. And that's when you have to, not to keep things around, just print what's enough, or whatever is the method of control. But I rarely see that people on the floor are trained.
Implement a system, right? And when you find gaps, don't just think that, well, the root cause is I didn't yell at them loud enough last time, right? What is the real root cause? And to that point, we have a root cause analysis web-based training you can take on our website. And John, I think you guys have BRC has a webinar or something that they've published as well, don't they?
Yep, absolutely.
So there are definitely some resources out there, but I would encourage you to check out our website too. We've got a training on that. And we do have a question, would digitizing forms work for document control? And certainly that's one approach that can be a great tool to help with document control, because there's no way of using the old version if it's digitized, right? You've got the latest version out all the time. So that's one good approach. Don't feel that you have to digitize in order to be BRC certified, but it is a great approach.
Yeah, back to senior management section again. It's funny, we've got 3 in this top 10 that come from that section, and this is about objectives. Generally, people, during the audit, I think you guys will find they have objectives. They cover off the quarterly report. There's enough communication, but what we've seen in non-conformances in general is there isn't a clear. Sometimes the objectives are there for the auditor, and not for the business. And when I say that, you could, if you walked into the senior management or to the person in charge of quality or person in charge of safety and said, what's your biggest problem? What would you like to improve? What's the number one thing on your hit list? You took those those things from those individuals, and then you looked at the objectives they're presenting the auditor, and they don't necessarily line up. So this is about just, use the whole concept of objectives that's identified in the standard as part of your business practice. You don't put stuff in place to make the auditor happy, put stuff in place to drive your business. So make sure that this one should be the business, and the standard just tells you how to organize it as opposed to doing something for the standard.
Yeah, and what I often see on this too is that companies focus too much on, again, on the business part of it, but the sales part of it, not the food safety, quality, and legality part of
Yeah.
it. So as far as BRC goes, that's what we're looking for. What is gonna be make your customers happier? What is gonna decrease the risk of a food safety incident? And also, what I've seen is like companies use goals like it is actually not a goal; it's a responsibility of the company. Like for instance, say zero illness out there with the customer. It's like, well, that's kind of like your responsibility already. It's kind of not a goal, right?
It's not a nice to have.
It's like, oh, comply with the, with regulations. Well, that's not a goal. That's your obligation.
Yeah, that's a good way to put it.
That's a
So-
good point as well. Yes.
Yeah.
So, again, I think there's a little bit of a lack of understanding. What is the intent of this? And I think also it is often used as a reactive mechanism and not too many times about a proactive mechanism, which I think is more of the intent, to get out there. What can we do better in quality and legality and with our customers and, with our systems and with, and things of that nature.
And BRC is not a checklist of things that you need to have in order to pass an audit. BRC is a system. And so when I look at this concept of objectives, it ties directly back to management review and the regular management meetings, right? So management should be reviewing the HACCP system, the BRC system as well, as a whole, and saying, okay, what do we need to work on this year? What do we need to improve as a company? We set these objectives, we track them regularly in these monthly meetings we're having, right? We track against these objectives, say, okay, how are we doing on them? What resources do we need? Where are we lacking? Where are we doing well? Let's celebrate those wins together as well to help drive that food safety culture. It all really ties together, right? And if you don't set objectives for food safety, how can you say that you're working toward a food safety culture and you've got a good food safety program in place if you don't even have objectives and goals for the year toward food safety, right? And so, it doesn't mean we have to have a separate program for food safety goals. I would say integrate them with your existing KPIs that you have, right? We're trying to cut down on costs, we're trying to reduce waste, and and they can all align. You can improve quality and reduce waste at the same time.
Yeah.
Right. So business and food safety and quality often can tie together if you do it right.
Yeah, exactly. If they do it right. But again, as an auditor and as part of the program, we're not focusing on their efficiencies and things of that nature.
Right.
We're focusing on, okay, how does that impact, food safety, quality, legality, integrity? And also, I think part of the, misses that I've seen is that those goals or objectives are not clear, they're not communicated, they're not followed up, or they're not measurable. So there are a few things about reading the details and coming up with those good goals.
John, I got to say, when we get into the discussion in these webinars, it's always challenging to keep time because it's such a priority for all of us. And
It is.
And what we live and breathe every day. And we have such great discussions. So
yeah, and you'd like to be able to pass that on, but we'll get through it. And I don't mind saying a little bit extra if we need to, but I think we'll get through it, no problem.
yeah. So you want to go ahead and jump onto this one? This is another common one, isn't it?
It is. Two things drive this one: the economy. If we have, when we have real significant challenges to the economy or economy in various parts of the world, we see this come into play significantly more because people are trying to stretch or reuse or use used. The other one we see this is, again, when these smaller facilities are stepping up into certification, that, what was okay for when it was a family 3-person operation, now you're getting into a real head-on business. Sometimes it has to be reviewed. So nothing extravagant, nothing crazy about this one. Sometimes it does take a hit in an audit to drive the point home and get everybody focused on, we got to replace that old tin piece of whatever that functioned when we were small, but we need to step up and get a professional piece of equipment now. So nothing spectacular. That's an internal audit issue.
This one goes right along with document control as one that I believe will probably continue to show up in audits regularly. And then it seems like, hey, we had this brand new facility 15 years ago, but now there are things we need to start replacing or updating. It's just the nature of the beast.
Yep. Big one. Big one. Now, this is, again, relatively new from the last version. It's about vulnerability assessment, so food fraud. And a couple of big pieces on this. Non-conformities tend to be of two cases. One, they just completely missed something that should realistically have been on there. And I'm caution people, don't put everything on there to avoid this. It has to be realistic. Or missing something during the review. And number one way to do it wrong is to rely on the opinion of one person in the plant or one or two people in the plant to say, hey, let's base it on our experience. Let's do a vulnerability assessment. Probably the worst thing you can do, because fraud, when you think of the frequency and severity, things like fraud frequency is extremely low in most cases. Severity can be extremely high in most cases. So it's not something people are going to generally have a lot of experience with. This is where they need to go back to trade association, get a wider view, get a bigger perspective, look at some industry associations, and get a much broader perspective rather than just use a single person's, what their experience has been.
Right, you don't want to wait until it's happened to you before you put a control in place, right? You want to look at what happened elsewhere and prevent it from happening to you.
Absolutely. Use others' bad experiences to put your mitigating strategies in place. The other piece to this is like culture. This is like the environment. You're never there. You never get to a point of saying, okay, we're good enough, we can stop. You will always look at, go through, we've got 200 raw materials, pick the top 5. Put mitigating strategies in place for them. Then next year, take a look at it again, and next year, take a look at it again. Yeah. This is one of those things where it's not done once and walk away and you're complete. It's a big piece of work.
Yes, I agree that and I see also a lot of non-compliance with this. I've been in companies where they do a really good job where they really go and dig into history, and they really use publications, associations, and they come up with a pretty good study of that. And then if they find something, then they put a mitigation measure in it. But on the other side of it, I've seen companies where it seems like they didn't read the requirements of the standard and saying, okay, you have to look at historical evidence. You have to look at, the complexity of the supply chain. You have to look at, the detectability and all these things. So they miss these mandatory elements where you need to look at least on those in order to come up with your assessment. Mm-hmm. Or sometimes facilities also say, well, I'm just packing whatever, I don't know, pistachios or raisins or something like that. What is to be fraudulent on that? So that's not applicable. Well, it is always applicable, right? The only thing, you find nothing, you did your assessment, you find nothing, great, right? But it's always, there has to be evidence that we went and did that exercise.
Yeah, it's just like HACCP, right? You can't just say, well, it's assumed that it's not going to happen, so I don't have to write it down. You have to do the assessment and show that it's not going to happen.
Exactly.
Excellent. This goes back to like the one before. This is every quality manager's bane of their existence. Temporary repairs when it comes to an audit time. Yeah. We absolutely accept the fact temporary repairs will be in place. That's how facilities have run and will always run. No problem with that. Couple of things to avoid this becoming an audit. You have a temporary repair procedure. How's it documented? Where is it documented? Every temporary repair should automatically be accompanied by a work order that goes into your system. That way it's now traceable, right? If so I did a temporary repair, I issue a work order that goes into our PM or our maintenance tracking system, and that work order is for the final repair. Mm-hmm. Be careful about temporary repairs and how they're viewed. They are a direct line to the culture of the organization. Temporary repairs are a message about how you treat your product.
Yeah.
So, always do it right.
What we don't want to see as an auditor, right, is temporary repairs using materials like duct tape or cardboard that can put the product at risk, right? Or we've got a system where we date our temporary repairs, and you go out and look, and the date it was 2 years ago, and they're supposed to replace it within 2 weeks. right? Those are things that can commonly go wrong with temporary repairs. So we're looking for, again, just control,
Yeah.
right? And mitigation of risk when you do it. So quickly, we've got a question. The food fraud assessment, should it include a cross-functional team and not just the food safety manager? Because, of course, the food safety manager, how are they going to know everything?
Yes.
Right. So what do you think as far as best practices?
Definitely. I mean, it's also what about purchasing, what they know, what they've seen, right?
Right.
Their brokers maybe, right?
Yeah.
Again, history, there are web pages out there where you can, go and pay a good sum of money, but
Mhm.
you'll find something if you think that your product is a certain, high vulnerability
Mhm.
or something of that nature. But
Right.
definitely has to be looked from different angles, and it cannot be just like HACCP again. It cannot be done just by one
Right.
person
Just like HACCP.
and from one angle.
Yeah. I would say too, as these things come up, if there are questions you guys have, attendees that you would like answered in the future, we would consider maybe having another webinar on a topic like food fraud and really dig in a little bit more. Shoot us an email. Let us know what you're thinking about. And of course, as we work toward wrapping this up, there is a survey we will be sending out. It'll pop up in the system. So please answer those questions. Let us know how we're doing. Give us some feedback. We want to continue to provide this type of free and useful material to you folks in the future. That helps us to do that in a better way that will assist you in your job and in your managing your systems. So you want to talk briefly a little bit about the BRCGS professional program?
Yeah,
John?
I want to just throw that in because I think it's got a pretty direct tie-in to what we're talking about. I mean, what we covered was a deeper understanding of the requirements, the standards, the clauses within it, reaction to audit technique, internal audit. We covered a lot of those things, vulnerability assessments, and it's got a direct tie into professional. So professional is an individual designation. There are a number of training courses that have to be taken through our ATP network. We allow, things like HACCP, we expect them to come with, can be provided if they don't have it, but we have a number of specific training topics that have to be gone through, things like internal audit, vulnerability assessment, validation, root cause analysis. So some real good building blocks. Once people get all of those under their belts, here's one of the many people that have reached that status of being given the BRC Professional Award. So it's a great tool. We see, and we're starting to see now that we've got enough people in the system, a pretty close connection between grade on the audit and investment in this type of thing. So makes sense, right? It's part of the culture of the organization. You upgrade your staff, get them better qualified, more competent, you're going to see the results during the audit. So
it's going to benefit, it's going to benefit the company, and it's going to benefit the participant, right? To say, okay, you need to take one of these classes, and 2 or 3 or whatever it was. I don't remember the exact structure, but it integrates things like you've got to have HACCP, you've got to have PCQI. So it really is kind of a way to say, yes, I have these qualifications where I'm confident in my ability, and not only having that confidence and credentials, but helping to improve your program as you gain information from those courses. So I think it's a great approach, Don. I really do.
Yep.
So we've had a number of people ask, by the way, and these are the standards from BRCGS here, but we've had a number of questions asking if we're going to be sending out a recording, and we do plan to send out a recording of the webinar for sure. And so definitely, if you didn't get a chance to listen to the whole thing, listen to that, and then again, reach out to us with any questions you've got. Is there a list or recommendation of items that can or cannot be used as a temporary repair? And I don't think it's a hard list, although there are some things we can say for sure. Things like duct tape, cardboard, carpeting should not be used. It comes down to risk. It comes down to assessing risk, right? So a company may be able to say, okay, look, these materials are okay in our operation, and that may be different for a company that's a dry operation than a wet operation, or a high risk, right? High care versus a low risk product.
Or how close is it to the product flow, versus is it like right by a conveyor, above the conveyor, or is it like right on a corner on the floor, right? So there are several ways to see the risk.
Yeah. So I could give you a list of things that should never be used anywhere in the food industry, but to give you a list of things that are okay, that depends.
Yeah.
So again, it depends.
It depends.
I think the most common temporary repair is probably a pair of vice grips, isn't it?
Yeah. So zip ties are a big one too.
Zip ties as well,
Yeah.
absolutely.
So we've got just a couple of slides about our company. I would love to share with the attendees a little bit about who we are. Even if you're familiar with us, we do offer laboratory services. We founded our laboratories in the 1940s, believe it or not, been around a long time. Those are our locations in front of you. And so we do receive samples from all over the country for pesticide analysis, full micro screening, and reach out to us with any questions you have. And we'd love to work with you, understand your operation and what you need, and try to help you with that. Training and consulting, we do offer courses, and we do offer consulting on HACCP, GFSI, FSMA. We also have on-site services. We specialize in customizing training to your team and what you need. And so we have quite a few modular trainings on the different FSMA regulations, on HACCP, on advanced HACCP, things like that. Internal auditing, we offer a course on that. So we can come for a day or two on site and do a customized set of materials based on what you need. Here is our course catalog for our web-based training. So we do have a number of courses. So we've got these three. There's also root cause analysis, and we're getting ready to add some more here in the coming months. So we do have web-based training that you can take. Upcoming public training courses, and we'll send these out afterward as well. Definitely encourage you to sign up. We do have a free information day in the Los Angeles area if you're down there. We've also got a sanitation workshop. We got some BRC training. You can see there's a wide variety of courses we're offering. And again, if you don't see one that works for you, gosh, reach out to us. Right? We'd love to set something up if you have training that you need. And then the certification audits, which, Antonio works for the certification body. I don't know if you want to just kind of take a minute to briefly go over that.
Well, yeah, we offer obviously our BRC audits, including the START program, SQF, HACCP, and also if you're thinking about going BRC soon and you're not sure as to where you are at right now, feel free to reach us and we can do a pre-assessment, so to help you realize where you're at in the path of certification.
Yeah, and our administrative person, Sam, will talk to you all about what's required, how the process works, answer your questions.
Yeah, we'll help you all the way from, your beginning, your application, what you need, where you're at, and guiding you all throughout the certification process.
Definitely. And last thing, come see us in Monterey at our